Welcome back to Recharging the Human Battery here on AM 950 Radio. Dr. Sinacropi is out today, so you've got the co-host here, nurse practitioner Mandi Dickey in studio with you today. So we are going to pick up, as usual, when I come on the show by myself, we're going to pick up with those ABCs of concussion. But to kind of get you up to speed, we've had a lot of changes in healthcare lately. We've had a lot of changes in the concussion world. I've had some changes, so I'm no longer working full-time with Hypercharge, but I'm still doing some work with them and working on a concussion clinic with Minneapolis Clinic of Neurology, so you can find me up there. My podcast is still going strong, Brain Wellness, the podcast, so if you're looking for some more brain-specific information, please feel free to follow me over there. And this week I was really excited to get voted into the board of directors for the Minnesota Brain Injury Alliance. So if you've been listening to the show for any amount of time, you know how passionate I have become about just brain injury, specifically after my own injury. And all of these things kind of culminating and coming together just really fuels my passion even more. So, Dr. Sinacropi and I get to kind of geek out on this show a lot about different topics that we get passionate about. And this is definitely one of them for me. So today, when we talk about these ABCs of concussion, again, why I'm doing this whole series and why I'm bringing it on here is because there's just not enough information known about concussion. People don't understand in general that concussion is a brain injury. So that's one thing that I've been talking about over and over is that concussion is a brain injury. And when we talk about brain injuries, it's not a once and done type of thing. So for a long time, we've always talked about brain injury as just an event. You have a brain injury, you get over it. And for the long time, we thought that hardly anybody had long-term symptoms. We know now that about a third of people continue to have symptoms long-term. And that's where some of these letters come in. So as we're talking about all these letters every week, it's all things that can be related to brain injury, whether you are the person that has the brain injury or you have a loved one that has a brain injury. Sometimes we don't know that it was a brain injury that caused our symptoms. And I was actually just reading an article yesterday about pediatric brain injuries, what happens in kids when they have a brain injury. And their little brains are developing so rapidly at that time that if injuries happen at specific times when their brains should be developing, those things don't develop as they're supposed to, but it doesn't always show up right away. Whereas adults, our brains are done growing. We're not really changing much anymore other than the little bits of neuroplasticity that we talk about. But when kids' brains have injuries, that might not show up until years later when they're getting diagnosed with things like ADHD or behavior issues in school. And we don't really put those two things together. So as we're talking about all these different topics, think about if you have some of these problems, when did they start? Think back and try to decide if there was something that may have caused a head injury prior to these symptoms starting. And this might be the long-lasting consequence of that brain injury rather than being a diagnosis by itself. So think about those times when something may have happened. And again, as we've talked about on the show before here, you don't have to lose consciousness. Only about 10% of people with a head injury actually lose consciousness, and only about half of the people actually hit their head. The rest of it is inertia. It's the force of the brain moving around inside the skull that causes the damage. So when we think about brain injury, we talk about brain injury, and as I'm talking with patients in clinic and asking about any previous head injuries, that's when I come up with that little side description. You don't have to hit your head. You don't have to lose consciousness. And given that, does that change your idea about how many previous head injuries you may have had? Because that does make a difference in how you recover. So again, back to today's and what we're going to talk about when we come back from the break here today is everything that begins with the letter H. So we've moved up the alphabet. We're doing the letter H today in the ABCs of concussion. So I'll be talking about things like headache, like hemorrhage of the brain, humor, hydration, hitting your wall. And that's a term that I've still used pretty frequently in my recovery, all the way down to hormones. So we've got lots of different topics today, all that start with the letter H. And we're going to have a really good show. I look forward to it when we come back from the break, again, here on AM 950 Radio with Recharging the Human Battery. I am Mandi Dickey. Welcome back to Recharging the Human Battery again. again here on AM 950 Radio. Again, as I was saying before the break, Dr. Sinacropi's out today. You've just got me, Mandi Dickey, talking about my favorite topic, concussions and head injuries. It's not my favorite topic to actually have happen to people, but it's my favorite topic to talk about because I've become so super passionate about it. So again, today is the letter H in the ABCs of concussion. So we're moving right along. Things that we're going to talk about today will all start with the letter H and again be related to either things that happen because of a brain injury or some things that might come about as you're in that healing process and topics that are related to it. The first topic I want to talk about today is headaches, because that is the number one symptom that brings people in to get medical treatment after a concussion or a head injury. Headache is the number one, and that is the number one thing that got me in for treatment after mine as well. So I have definitely personal experience that I can talk about on this one. When we talk about headaches, we really need to identify the fact that there are different types of headaches that can happen. And this thing that we call post-concussive headaches is no joke. And post-concussive headaches are different from any other types of headaches. I want to kind of separate those out for a moment. Some people that have head injuries will have an increase in migraines. Some people will develop new migraines after an injury. Some have a decrease in their migraines. But it's really important to differentiate between what a migraine is and what is not a migraine. Even my husband, we joke at home, he calls his really bad headaches migraines. And I'm like, babe, that is not a migraine. So let me tell you for a moment here. A migraine is typically pain that's on one side of the head. It can involve both sides of the head, but generally it is one side of the head. It's a throbbing pain, so kind of like you feel your heart beating in that one side of your head. You may have sensitivity to light or sound with it. You may have nausea and or vomiting. People usually need to be in a dark room for it. But it's definitely a different type of pain. It's that unilateral, one-sided head pain. Whereas things like tension headaches kind of feel like a rubber band around your head. A post-concussive headache is a little bit different too, in that it typically is either the front or the back of the head, and it typically feels more just like an increased pressure. Sometimes people will report it as it feels like their head is just going to burst because there's so much pressure inside of their head. Sometimes they feel different sensory things with it, kind of numbness, tingling on the sides of the head. But again, it's usually front and or back. There are cervicogenic headaches that can happen, especially if people have whiplash injuries, and then you've got pain coming from the back of the neck up the back of the head. Again, those are very different from migraines. So a lot of the time when we're in clinic and we're trying to differentiate what kind of headache the person is having, you really need to talk about what the symptoms are. What does it feel like? It's not just a headache. There's different descriptors that we can use with it. What type of pain does it feel like? Where on the head does it hurt? When does it hurt? Migraines will typically get worse with activity, but then again, so do post-concussive headaches. Cervicogenic headaches, not necessarily unless you're doing stuff with the neck, but those post-concussive headaches are a different kind of beast. They don't typically respond to the same kind of treatments. Some references that you look at will say, yes, you can use the same kind of treatments for migraine that you can for post-concussive headaches, but I will tell you from personal experience, they don't always work. So we really do need to identify first what kind of headache a person is having when they come in. So again, if you are that person that has the head injury, really kind of take note about when they happen, how often they happen, what kind of symptoms you're having with it, what kind of feelings are you having with that headache. Another thing to really take note of is if you have any triggers for those headaches. And this is where it does come in similarity, the post-concussive headaches versus migraines. The triggers are very similar. Lack of sleep and or poor sleep. So if you're not getting good sleep throughout the night, if you are only sleeping for little bits of time and then waking up frequently, if you're having trouble getting back to sleep, and then things like strong smells, really loud noises, stress, anxiety, skipped meals. So if you forget to eat, if you're not hungry and you don't eat, if you're trying to actively lose weight and purposely not letting yourself eat, skipping those meals will bring on headaches. Dehydration, if you're not drinking enough water, that will also bring on a headache, either a migraine or a post-concussive headache. And then cognitive or physical exertion is really common as a trigger for those post-concussive headaches, meaning if you have to do a lot, think a lot, if you are in situations where there's a lot of loud noises, a lot of stimuli, those can trigger your post-concussive headaches because your brain just can't handle all of that stimulation without having some sort of outlet. Physical exertion, again, if you try to do too much too quickly, that can also bring on those post-concussive headaches. And the thing that I dislike when people ask me, because I don't have a really good answer, is how long will post-concussive headaches last? And in the research, it will tell you that most patients resolve within 3 to 6 months, and that may be true, but likely it can last longer if you had headaches prior to your head injury. So if you had headaches prior, whether it be migraines or tension headaches, you're probably going to be more likely to have these post-concussive headaches, and they're probably going to last a little bit longer. And if your stress is not managed, and stress is a huge thing after a concussion, if that stress is not managed, it will likely have those headaches stick around also, because stress is a trigger for those headaches. So those types of things can make those headaches last longer, make them a little bit more difficult to manage. And then again, they're often related to those neck injuries. So we really need to address the whiplash part of it, address the neck injuries with physical therapy, acupuncture, chiropractic manipulation, any kind of manipulation that we can do. Osteopathic physicians do a lot of manipulation as well. So any of that can be helpful for reducing the neck tension part of it, that can decrease those related headaches. Other management techniques, lifestyle is always going to be more important than any kind of medication that I could prescribe. So lifestyle management means eating healthy. And what is eating healthy? Everybody has a different definition of that, truly. But as I talk to my patients, we're always talking about eat the rainbow, eat a wide variety of foods, because you need a wide variety of vitamins. And if you're always eating the same foods, you're not necessarily going to get the same kind of vitamins. All those different colors of the vegetables that you see, they all have different nutrients and different vitamins. You need to get a little bit of all of those. And trying to avoid things that cause inflammation in your diet. So processed foods cause a lot of inflammation. Fast food, anything that comes pre-packaged, that's going to cause inflammation, because if they have to make it last on the shelf before it gets to you, there are things in there that can cause inflammation. So trying to eat whole, fresh foods as much as possible, eat the rainbow, get all the different nutrients in. Stay hydrated, and we'll talk about that a little bit more today as well, but really make sure that you get a good, adequate hydration via water, non-caffeinated beverages, things like that. And again, we'll talk about that a little bit more later on. Exercising regularly. Exercise can be a difficult thing after a concussion, because a lot of people have limitations with that exercise intolerance, as we've talked about in previous letters of the alphabet. But even just walking, a little bit of walking on a day-to-day basis will help to decrease some of those headaches a little bit as well. Again, manage the stress, get regular sleep. We talk about sleep hygiene all the time in my clinic. And what does that mean? It means going to sleep and waking up at the same time, regardless of what day of the week it is. Staying off electronic devices for at least an hour before you go to bed. Maybe drink chamomile tea or something before you go to bed, magnesium. Take a warm bath. Get in some kind of routine where you're doing these relaxing things before you go to bed. Don't do stressful things before you go to sleep. Relaxation, again, deep breathing, progressive muscle relaxation, guided imagery, biofeedback, mindfulness, any of that can be helpful for decreasing the stress part of those headaches, because it's there. We just got to deal with it. The neck exercises, as I mentioned, acupuncture, neuromodulation can be really helpful for headaches as well via either nerve stimulation. I have the dolphin neurostimulator would be one way that you can treat that. And there are also in-office treatments such as microcurrent that can be used to treat the neck pain part of it especially, or occipital pain in the back part of the head, that really can kind of alleviate some of those pains from happening. And then we talk about abortive medications when we talk about headache, and that's medication that you take to stop the headache from happening. And things like ibuprofen, aspirin, acetaminophen, those are going to be your first line treatments. Over-the-counter medications are simple to use. They are very effective still for most people. The thing that you need to note with them is that even though they're over the counter, you can still get too much of them. That too much of a good thing phenomenon is still there with over the counter medications. So you don't want to use them more than twice a week, really. Definitely not every day, because if you're using it every day, then you're putting yourself at risk for what we call either an overuse headache or a rebound headache. So essentially your body gets used to taking that ibuprofen, acetaminophen, whatever it is that you're taking. And if you try to go a day without it, you're going to have a headache. So it's not a good idea to use those on a regular basis. If you are somebody that's having more than 15 headache days in a month, meaning more than half the month you're having headaches, then we really need to look at preventive medications. So rather than taking that ibuprofen on a daily basis, we take a prescription medication on a daily basis to prevent the headaches from happening. So it doesn't necessarily treat the cause of the symptoms, it treats the symptoms themselves. Those same preventive medications that we use for migraine are the things that we would use still for prevention of those daily post-concussive headaches. And then may or may not work, but they're there for them. The categories that we use for medications, just to kind of let you know what they are, they're beta blockers. So there's heart medications that we can use, anti-seizure medications, antidepressants. Those are our three main categories that we choose from when we're talking about daily preventive medications. And all of those typically come at a lower dose than we would normally treat either seizures, depression, blood pressure, but they do help in a variety of ways to decrease those headaches. So we typically will have that conversation and figure out which one's going to be right for the patient. So all of that to say that there's a lot that goes on with headache, and it's, again, really important to get good information. My word to patients all the time is try as much as you can to keep some sort of a headache diary. You've got your phone on you all the time. Keep a little running notepad of when you have your headaches and what's going on, what triggers you might have, what are things that might make it better, so that informs our conversation in clinic, and it also informs your treatment. How are we going to do, what can we do to make you feel better? So that's the first letter of the alphabet today. Our next H is going to be a really brief one, but hygiene. And this is something that people sometimes don't really think about much, but it often takes a back seat when we're recovering from a head injury. It's not typically that first thing that you're thinking of. When you are getting up, you're going to school, you're going to work every day, you're getting up, you're taking your shower, you're doing your things to take care of yourself. But when you're not in that same routine and you're stuck in a dark room because you've got headaches and you're not feeling good, showering is kind of the last thing on your mind. So people can forget to shower. They just don't have they have a lack of motivation to shower. If somebody has physical limitations after a head injury, they might need assistance from another person or some sort of device, such as like a shower chair if they can't stand up in the shower for very long, or bars or railings in the shower and tub that they can hold on to get in and out because of dizziness, balance issues, things like that. If there are any lacerations involved in the injury, you need to be cautious about cleaning those carefully and gently so that you don't open anything back up again. And for somebody that might have had a severe head injury and have a risk of seizures, we don't recommend that they take baths alone. So hygiene might be more difficult because you have to have somebody present or have somebody there, which can decrease the feelings of independence for people and just kind of make things uncomfortable sometimes to make sure that you have somebody there. So just knowing that might be an issue. If you are the caregiver taking care of somebody that has a head injury, gently reminding them that they need to take care of their hygiene, asking them if they need help, encouraging them that way. If you are the person that has a head injury, again, marking it on your calendar, maybe setting a reminder for yourself every day so that you do that. Even if you're not getting up and going to those same activities, that's one little thing that you can do to help you feel a little bit more like a regular person. Next topic, again, another really brief one because we've already covered it way back in the B letter. So if you want to cover this one more, go back and listen to that B episode. But hemorrhage. So when we talk about brain hemorrhage, brain bleed is another word for it, which is why I talked about it back in the B section. I did want to bring it up again, even though I've already talked about it back in the Bs, because hemorrhage is why we get that brain imaging most often. So when we have somebody come in and we're concerned about a concussion or a head injury, we get a CT on that emergent scan because we're concerned for a potential bleed into the brain. If we get a scan later on, we're not going to typically get that CT right then. At that point, we're going to get an MRI because an MRI after the first few days is going to be more specific and more sensitive to catch bleeds than a CT would be later on. However, 99% of head images that we do are going to be negative, meaning they don't show anything because there's not a bleed involved. So that's the reason we do those imaging most often, because on a CT, on an MRI, we're not really going to see changes related to the concussion unless they've had multiple concussions or a severe concussion years ago. Then we can start to see some little itty-bitty changes on the brain. So the hemorrhage is irritating on the brain. Blood on the brain is just irritating by itself, and it increases the risk for seizures, and that's why we're also concerned about hemorrhage with a brain injury. So again, just wanted to briefly touch on it. I did talk about it a lot more back in the B with the brain bleed. So if you want to hear a little bit more about that one and you don't remember it or you didn't listen to that episode, go back to letter B way back there. Next topic then is humor. And this is kind of a fun one to talk about. But recently on my podcast, I had a gal named Mimi Hayes on my show. And I met her when I went out to Washington, D.C. for the National Brain Injury Conference. She was another fellow brain injury survivor who used her brain injury to become a comedian. So she learned this ability to exert herself in different ways. And she really kind of took it to the stage and took it to being a performer. And we talked about her experience, her brain bleed experience that led to her brain injury and how it led to her becoming a comedian. And we talked about just kind of how humor can change after a concussion. And it really can. So when we're thinking about what happens in the brain, we have these hormonal changes, we have chemical changes in the brain that alter maybe who you are a little bit. It changes your personality. It can change how you perceive humor. So some people get this just a decreased ability to understand or appreciate humor from other people. Like, I've always been able to understand dry humor, no problem. I find it hilarious. And that went away for a while after my concussion. I just really didn't get humor the same level that I used to. So another thing you might see is that sometimes people will laugh without really kind of any explanation. So they might laugh and find things humorous where there's really no humor. So it almost seems like an inappropriate response. And then some people will use humor as a coping mechanism. And sometimes we say that we laugh because if we don't laugh, we'll cry about things. And that can be very true in the sense of brain injury when you're trying to recover and life is not quite what it used to be and you can't quite do the same things that you used to do, that sometimes people will joke inappropriately as they try to come to terms with traumatic events in their lives. I may or may not have done this for a while myself, but just because people joke about things doesn't mean they're okay with it. So when Mimi was on my podcast and we were talking about this, we also talked about how in society, sometimes it's more socially acceptable to joke about things than to have serious conversations. And if you find that this is something that you're having an issue with, then it is important to have those serious conversations. That said, though, humor can be very important, and it is a really good stress relief technique. So when we were talking on my podcast, she was asking me about if there's anything interesting about my humor now. And when I find things funny, I am 100% in. So I always say that whatever emotion I'm feeling, I am 100% there. I have this really goofy laugh that comes out when I laugh really hard. And it's been present way more since my brain injury than it was prior to my injury, because I think I get to that point where things are just so funny because I'm able to enjoy them more. So humor can be a very important thing. Yes, it can mask some of those deeper symptoms that you might need to address some of those serious things, but humor is still very important. The next H letter is hydration. So I said I was going to talk about it more, and hydration, I know we have talked about this on previous episodes, not even just the alphabet, but in previous episodes in general on this show, we've talked about hydration and how it's really important because it's a natural thing in our body. And when we talk about hydration, we're really not any of us good at hydration. I've seen people that I've worked with before that carry around these gigantic water jugs, and some of those people are really good about drinking it, and some of those people are really good about carrying around these giant water jugs. So the other part is if you're going to bring that water jug with you, you have to be willing to drink it because you can't get it by osmosis. You actually have to drink the water. Recommendation is that you drink about half your body weight in pounds, half your body weight in ounces compared to your pounds. So take your body weight in pounds, divide it by half. That is the number of ounces of water you should drink on a daily basis just for your baseline. If you are drinking alcohol, if you're drinking caffeinated beverages, you need to increase that. If you're exercising, you need to increase that because you're going to sweat off more of that water. But alcohol and caffeinated beverages are dehydrating. They're going to reduce the water intake. So I usually tell my patients, if you drink coffee, for every cup of coffee you have to have the same glass of water because you need to replenish that hydration. So what counts for hydration? Water, obviously, herbal teas that do not have caffeine, broth, or anything that's clear at room temperature except for sodas. So clear sodas do not count because they have caffeine. They're going to dehydrate you. So what doesn't count other than the soda? Milk, caffeinated beverages, alcohol, Again, anything that's not clear, not decaffeinated. And try not to drink a lot of water after dinner, and that should kind of come as a common sense thing. But if you're drinking a lot of water after dinner time, you're going to be up all night using the bathroom. And again, we talked about the importance of sleep. You need your sleep. So start drinking as soon as you wake up in the morning. Taper it off at dinner time. Don't really drink a whole lot after that. Otherwise, you're not going to get that good sleep. The next topic that I want to talk about is hitting the wall. And this is a term that I've used a lot in my recovery process, but you only have so much energy, whether it's physical or cognitive, that you can expend at any given time. Your brain is using excess energy to try to heal. We've talked about this before. And that's one of the things that we treat at Hypercharge is the whole idea of your mitochondria not being able to create the energy in your body. So when we have that mitochondrial damage or mitochondrial paralysis, you cannot create the energy that's needed in order to do basic life functioning, much less the excess energy that's required for healing. So this is where you kind of reach a limit, and I always say that you kind of have overdone it at this point, and you need to take a break. That's hitting your wall. You've had these symptoms come on because you've done too much, and you don't have the energy to keep going. So it feels like you literally hit a wall, and your body is telling you to stop. And at this point, when you hit that wall, you often have increased symptoms. Sometimes you feel like you just had your brain injury happen all over again because those symptoms can come back so severely. The recovery time will depend on whether you continue to push through that wall or if you actually listen to your body and stop. So it may take hours, it may take a day or more to recover, depending on how hard you hit that wall. And I will also say that it's often not noticed by the person that's hitting the wall, but it's noticed by someone else who's familiar with the individual. This was a really good example with my husband noticed this long before I did. After a few months after my accident, he saw the physical changes in my face and demeanor when that would have happened when I had those increase in symptoms when I hit my wall. I had no idea what he was talking about. I just felt crummy all the time. So I had no idea that this was happening when I would overdo it and I would actually physically change. And that's when he would start to see me have increased troubles with my word finding. My balance would get worse. My vision would get more blurry. And then my headache would kick in, and that's when I would notice it. But I never noticed it up until that headache point. So as we were going along, he would be able to kind of see those signs that things were coming up, and we were coming up again against my wall being hit. And then when I went to Washington, D.C. in March this year, I went with a friend of mine. I was able to see her hit her wall, and she couldn't feel it yet. So I was able to help her identify that. And she hadn't identified it to that point because, again, being the person with the injury, you don't really realize those symptoms as they're happening. So you need to have that other person that can help you identify that. It's very important for the individual then to try to identify triggers and signs to watch for. And it's really hard. But again, learning from others who've been able to identify when your wall is hit so that you can start to feel those sensations in your own body and you can try to monitor things a little bit better. And it's important, as I learned from my therapist along the way too, my occupational therapist, speech therapist, it's important to take regular breaks. Take the breaks before you feel like you need them, because that will prevent you from hitting your wall so hard. If you're taking those scheduled breaks, that will prevent you from having those symptoms kick in so hard and having to recover from that then. Some of the tricks that I've learned from my neurological chiropractor are some things that help with the autonomic system overdrive. So when we have that autonomic system kind of go haywire, sipping on pomegranate juice. There's been some research to show that it's an antioxidant. It can combat the inflammation in the brain. It contains nitrates and polyphenols that can improve blood flow and vessel dilation. So it actually does a whole lot in your body to try to prevent that autonomic system from going into overdrive at that point. Wearing a wrist compression brace kind of does a similar thing with that blood flow in your wrist and kind of grounds you with that autonomic system, just kind of stimulating a little bit with that pressure with the compression brace. So neither one of these are things that come with a lot of side effects. They're not prescription medication that can cause problems for you. Yes, pomegranate juice has some sugars in it, but those are natural sugars, so don't worry about that one so much. Don't drink the soda. Drink the pomegranate juice. It's actually helpful for you. So all of these things can help you try to prevent to hit those walls and keep you going so that you can continue to heal rather than having to take time to recover from hitting that wall. Because again, if you push through it and you don't take that break, you don't take that rest, that wall is going to be hit and it's going to take you a long time to recover. Trust me on that one. I've been there, done that, learned it the hard way. The next topic that I want to talk about is HRV. And heart rate variability is one that's a kind of cool up-and-coming thing right now, not just for brain injury, but for all sorts of health and healing topics. And heart rate variability, what it means is it is just looking at that variation time between heartbeats. It's a measurement of the autonomic nervous system activity. It measures the fluctuations in time intervals between heartbeats, and that measurement is in milliseconds. So it's just these brief little times that we can't even acknowledge on a regular basis just by ourselves. So it is a non-invasive measurement, meaning we don't have to put anything into the body to measure it. We can do it by EKG or by wearable devices like fitness trackers and smartwatches. So this is something that I'm really glad that I got the smartwatch that I did, because it can monitor that. And there are a lot of really cool gadgets out there that look at all sorts of different metrics in our body. And data is always great. I love data. It helps you kind of identify what you need to do, where your problem areas are in your body, what are things that you can work on. So I love this HRV data. How do you interpret it? If you have a smartwatch and you have that capability to look at your HRV, what do those numbers mean? You can have a high HRV or you can have a low HRV, or it can be right where it's supposed to be, obviously. But a high HRV means that your body is generally healthy and you have a resilient autonomic nervous system. It generally responds or corresponds with lower stress levels, better cardiovascular fitness. In general, it just means that you show adaptability with your heartbeat. So you can adapt to stressful situations, relaxation situations, things like that. A low HRV means that there's imbalance in your autonomic nervous system. It's correlated with increased stress, higher risk of cardiovascular problems, which again just basically means that you have less flexibility to react in the moment when you need to have these fluctuations in your heart rate. So sometimes if you get stressed, your heart rate doesn't come down like it's supposed to afterwards. You remain in that fight or flight mode, and that would lead to a low HRV. So after a concussion, individuals often experience a low HRV, that low heart rate variability, because they have less flexibility, and especially when they're symptomatic, it tends to be worse. So you can actually watch it change on your watch sometime and see when it says you're balanced or unbalanced. Factors that influence your heart rate variability: stress, obviously, sleep, and your diet. So things that we've already talked about today. So why does it happen after a concussion? We know that there are physiological changes. There's a physiological uncoupling of the autonomic nervous system and the cardiovascular system. Normally, these two systems work very closely together. And your heart rate and your brain, the neurotransmitters, the chemicals that go back and forth between, communicate to let us know what needs to happen with our heart rate at various times, how we respond to stressful situations. And changes in the brain's ability to regulate that autonomic nervous system function will lead to these changes in the heart rate variability. What's the significance of it? We can actually assess severity of concussion with this, because the lower the heart rate variability and the longer it stays low means, or typically correlates with, a higher level of severity of that concussion. And then we can monitor the recovery. We can potentially predict long-term outcomes based on this. There's a lot of research still going on with heart rate variability, but there's a lot of things that we can monitor with it and see how people are responding and how they're recovering from a brain injury based on what their heart rate variability is doing. How do we improve it? So things that are going to improve your autonomic nervous system are going to improve your heart rate variability. So meditation, mindfulness, working with a psychologist to manage stress, exercise in general, and then exercises for the vagus nerve specifically. This could include cold water immersion. Sounds like an uncomfortable thing to do, but it's actually very helpful. So cold plunges, whole body cold plunges, cold showers, putting your face into an ice bath, using an ice pack on the back of your neck. All of those things help to calm down the autonomic nervous system. They help to improve heart rate variability. Things that use vibration around your vagus nerve as it goes down your neck, things like humming, singing, gargling, things like that can also help to calm down the autonomic nervous system. Yoga, diaphragmatic breathing, massage, all of those things, again, help with the autonomic nervous system. Therefore, they also help with heart rate variability. And then vagal nerve stimulation would be another option for that also. So heart rate variability, definitely an up-and-coming thing in the research. Lots more to come on that one in the future because it is definitely an area where we can see some monitoring and changes happening in, again, just trying to figure out how to help people heal. And then one of the last big things I want to talk about before we go to our last break today is hormones. And hormones are kind of a big one because the hormone regulation in our body gets disrupted when we have brain injury. Up to 46% of patients experience some sort of neuroendocrine dysfunction. Neuroendocrine meaning the brain and our hormone system. The Puget Sound VA has been doing research into this particular topic, and they proposed a multi-site clinical trial for hormone replacement because of it, because it's such a big thing. When we're looking at almost half of people that have a brain injury have changes in their hormones, that's a huge population. We have like 3.4 million people walking around in the United States with a brain injury. So if you think half of those have hormone imbalances, that's a huge population that we need to deal with. So specifically with women, concussion can affect menstrual cycles. There was a JAMA article from back in 2017. This was the first to investigate menstrual patterns following concussion. It identified that 77% of the adolescent females that were in this study, so all people that had concussions, experienced abnormal menstrual cycles in the first 120 days following concussion. So there are some limitations to this study. It wasn't done very long. They didn't look at a huge number of patients, but that's a huge percentage of people to have abnormalities in their menstrual cycles, 77%. The concussions can exacerbate symptoms of perimenopause. So this is something, again, that's kind of getting a lot of attention in the news lately is perimenopause because people are talking about it. For most women, perimenopause occurs anywhere between ages 35 to 50. In people that have had concussion, it can actually kick that down early. So it can put women into perimenopause earlier than normal. And women can experience an exacerbation of the symptoms of both menopause, perimenopause, and post-concussion symptoms. Sometimes it's difficult to kind of tease out which one is the problem because the concussion head injury can cause symptoms that look like hormonal imbalance, but it also can cause hormonal imbalance. So then it's which one is it and which one are we dealing with? So it's really important then to work congruently with a women's health provider and a concussion provider, hopefully people that know the difference. So since I've been learning it, I have friends who are women's health providers, and I've been talking with them about these things too, to let them know for their patients that it might be another thing that they're dealing with. And for my patients, I've been referring them off to women's health to get those areas covered. The concussion primarily affects the pituitary gland, and that's where all of these hormones are produced. So when we get these hormones, we can either end up with too little or too much of the hormones. So the main hormones that we see coming from the pituitary gland are the growth hormone, adrenal hormone, thyroid, sex hormones, and antidiuretic hormones. So I'm briefly going to kind of cover what each of those might look like in somebody that has a deficiency or too much of that hormone. So growth hormone tends to peak at different times in our body, but growth hormone tends to lead to fatigue. So if we have an imbalance in that growth hormone, we can see a lot of fatigue, altered cognition, changes in body composition, because it also affects our metabolism, how we can metabolize foods. So we can see changes in that body composition related to that. Those symptoms sound very common because they are. So that's probably one of the biggest hormones that it gets affected. The adrenal hormone, when that is affected, we can end up with low cortisol levels. And cortisol is our stress hormone. So when we talk about that low cortisol, that's when we're seeing difficulties because of those stress levels. It affects the stress level response and, again, leads to fatigue. Thyroid hormone causes fatigue, weight gain, and metabolic issues. And I'll cover the last two when we come back from break. But again, lots of different hormones affected from the concussion potentially. And we will talk more about that when we come back from the break here on AM 950 Radio with Recharging the Human Battery. One last time today on Recharging the Human Battery here on AM 950 Radio. Again, Mandi Dickey here today talking about the ABCs of concussion. Letter H we've been talking about. And right before the break, we were talking about the hormones that can be affected from the pituitary, causing problems in the body. And again, we mentioned the growth hormone. If we have imbalances of that, we've got fatigue, altered cognition, and changes in body composition that can be seen. Someone has problems with the adrenal hormone. We can see problems with cortisol levels. It affects the stress response, leads to fatigue again. Thyroid, if that hormone is affected, we can see, again, fatigue, weight gain, metabolic issues. I'm seeing fatigue as a common theme with this one, right? Fatigue happens really commonly with concussion too. And then the sex hormones. So with this in particular, we can see a low estrogen in women that can kind of lead to those symptoms of early perimenopause. We can see low testosterone in men. It can affect menstrual cycles. It can affect libido. It can affect sexual function. So all of that can be affected from the sex hormones being altered because of a brain injury. And then antidiuretic hormone, that, if there are imbalances in that, can lead to excessive thirst and excessive urination with something we call diabetes insipidus. And it's not just being thirsty after you get hot from doing a workout. It is excessive thirst. I've seen it in the hospital before. So it's a definite problematic thing that you would notice. What happens if you have concerns with any of these hormones? The best thing to do is seek out an endocrinologist or a neuroendocrinologist for someone to reevaluate these hormones further. If it's just the sex hormones you're worried about, you can go to a women's health or men's health provider. But a neuroendocrinologist or endocrinologist can check all of these hormones for you and really look at the balance and see what's going on and try to see if hormone replacement would be necessary for any of these as well. Sometimes we do need to replace multiple hormones, but there's an order for replacement, and it's really important to work with your practitioner to figure that out. So that would require a referral to that different practitioner so you really can treat that well and get those systems back into working order so that you don't have all that fatigue and you can feel a little bit better. So then the last H letter I want to talk about today as we wrap up is hope. And this one is something that is very crucial in the process of recovering from a brain injury. Recovery from brain injury is not linear. It is not a straight-on path where you have the injury and life changes. And it's not going to be this uphill, continuous improvement. You're going to have ups and downs in that recovery process. There are setbacks that are very common. Progress is always possible, but it is, again, not linear. Hope is a belief that there is a better future, and it inspires us to take action. It helps reduce depression. It improves mental health. It can be found in many different ways. Some people find it through faith. Some people find it through support groups, from friends, from fellow TBI survivors. And I can tell you, I've kind of created my own little support group with a few survivors that they and I have become even better friends than we were before our accidents. But while hope can be very powerful, it is not a solution in itself. It sparks you to find the solutions. So I kind of liken this to when people say they pray for things and they wait for it to happen. You have to meet God halfway if you're going to be in prayer and find the answers that way. So you have to still search out those things that will help you get better. The big thing with hope is that I always tell people there is no end date to recovery. I had a patient come into my office this week who's a couple years out of their accident, and they asked me if this is how they're going to be forever. Is this their new baseline? And I very adamantly said, no, this is not your new baseline. This is your baseline for where you are currently. This is what your current symptoms are and what your current level of functioning is. That does not mean that this is how you're going to be for the rest of your life. As long as you continue looking for other options and you try new things, you will continue to get better. And that is the gold standard for recovery. There is no one-size-fits-all approach. Not as we talk about all of these things and all of these treatment options, there is no one treatment that will help everyone get better. There is no one treatment that will work for everyone. Everybody needs an individualized approach. And the main thing that will be holding you back in your recovery after a brain injury is your attitude. If you think there's no hope, you are right. If you think there is hope, you are also right. So which side of that right do you want to be on? I tend to lean on not a Pollyanna approach. It's not a roses and rainbows all the time. There are setbacks, but there's also hope. So you need that hope in response to brain injury. So wherever you are, if you're recovering, if you know somebody that's recovering, have hope, be there, be well. See you next time.